Sexual violence is pervasive and a serious violation of women's rights. This topic of sexual violence is of particular importance in India, where prevalence of both marital as well as non-marital sexual violence are higher than the global average. Around 6% of ever married women in India have experienced marital sexual violence in the past year, while 1% have experienced non-marital sexual violence at least once in their lifetime. These numbers are, of course, subject to reporting bias, given the stigma around revealing experiences of sexual violence, which is also one of the reasons why sexual violence is less understood with regards to its correlates and risk factors, since traditional statistical methods often fail to perform well with such low prevalence outcomes. With the goal of attempting to fill this gap in literature, we use an approach that integrates machine learning models with qualitative coding to identify broad themes or constructs that are potential correlates of an outcome from a very large data set of relevant indicators. We use a nationally representative demographic health survey conducted in 2014 to 2015 in India, which includes over 4,000 variables related to women's health status, their economic and social status, and their experiences of violence. Our analysis adopts a hypothesis generating approach where we include a very large number of variables, around 4,000 variables in our case, to identify potential correlates with machine learning models that have the ability to get rid of spurious associations and drop irrelevant variables. We then conduct an iterative thematic analysis of variables generated from a series of such machine learning models to identify different coherent themes or constructs that are the correlates of sexual violence. Our results show that there are 11 key themes associated with experience of marital sexual violence, while 8 themes were related to non-marital sexual violence. Marital sexual violence was predicted by past exposure to violence, sexual behavior, autonomy, both social and economic, and access to health systems. Non-marital sexual violence also had similar predictors, although sexual violence reported by unmarried adolescents correlated with higher wealth and mobility indicators, suggesting the difference in risks for sexual violence based on age as well as the relationship to the perpetrator. We find that our method of using machine learning in conjunction with qualitative coding to identify broad themes that are correlated to an outcome is a valid analytical approach that can identify variables associated with a given outcome that may not otherwise have been hypothesized, particularly for low prevalence outcomes where traditional statistical models fail to perform. Future research can use findings from our study to generate hypotheses for testing risk factors of sexual violence in India. Our findings with regards to sexual violence are also consistent with prior work, indicating its validity, and at the same time, it also shows novel correlates. Our analysis highlights several new themes that may be promising avenues to identify and support women experiencing violence in India. Thank you.